Hello, everyone. My name is Christina Martin, and my presentation today is on testing the level of empathy in the general population for children removed from the home due to parental substance abuse. In the year 2021 alone, 598,486 children in America were removed from their homes and placed into the foster care system. This is a shocking statistic. While not all of these children were removed due to parental substance abuse, studies show that neglect and parental drug misuse are the leading causes of removal in America. It is estimated that 50 to 80% of parents who are involved with the child welfare system have issues with substance abuse. Children with parents who suffer from substance abuse disorder often experience neglect and abuse during developmental stages and, in extreme cases, even child fatality. Infants who experience abuse are at increased risk of continued abuse before the age 5. In the year 2015, 81% of children who died due to abuse or neglect were between the ages of 0 and 3 years old. Almost 45% of white, non-Hispanic children who were removed due to parental drug misuse, and 13% of Asian and Black children were also removed due to the same reason. So, why is testing the level of empathy for these children important? Well, these children are our future generation. The effects of the challenges that they face from their parents' substance abuse disorder affect our society as a whole. These children are experiencing mental health adversities, and they will grow up to be a large population of the adults in our future society. Parental substance abuse is linked to 11 to 14% of investigated cases, 18 to 24% of substantiated cases, 24 to 56% of family preservation cases, and 50 to 79% of foster care cases. The effects of parental drug use may begin before a child is even born. These effects can include low birth weight, delivery complications, physical deformities, and cognitive development delays. These are due to substance abuse during pregnancy. Some of the challenges that children of parents with substance abuse face are physical and emotional abuse. They face inadequate and unstable housing, incarceration of one or both parents, abandonment, family conflicts, violence, and high risk of domestic violence in their homes. And once they are removed, they also face disenfranchised grief, which is grief that is not openly acknowledged or publicly validated. They can also face other challenges such as low self-esteem, low academic scores, increased high school dropout rates. And the increased high school dropout rates is significant because studies show that communities with higher rates of graduation tend to flourish and have higher rates of stability. These communities show lower rates of crime and greater qualities of life. Some of the effects that these challenges have on children with parents that have substance abuse disorder include poor physical health, emotional distress, substandard mental health, behavioral problems, and high risk for substance abuse disorders. Many of the leading causes of death in adults are highly correlated with exposure to negative life events as in childhood. These negative life events can include psychological, physical, or sexual abuse, violence against the child's mother, and they also include living in homes where anyone has a substance abuse disorder, anyone who is mentally ill or suicidal living in the same home with a child, or anyone that has ever been imprisoned. A high level of empathy for these children is needed in our general population. Many of these children have little to no chance of reunification with their biological parents. Oftentimes, these children may not be permanently placed or adopted right away. They may be moved to several different foster homes before ever being adopted, if they are ever adopted. Age, of course, plays a huge part in this. Many times, younger children are adopted much quicker than older children. So empathy for these children will help these children to view themselves as resilient survivors rather than just being troubled children or, as they grow up, troubled adults. Empathy helps to shield children from stigmas and shame. Many of these children face or feel shame for their parents' decisions and choices. Empathy can help break the cycle of blame. It can also encourage communities to protect rather than to punish. All of those things promote mental well-being and a path to overcoming circumstances that were out of the control of these children. These children need highly empathetic caregivers, teachers, social workers, and counselors, bus drivers, doctors, and everyone who makes up the general population. Empathy creates a nurturing environment that fosters emotional recovery. When we test a population for their level of empathy for these children, we can increase awareness and empathetic levels, as well as improve interventions and treatment methods. If it is found that society or the general population does have a low level of empathy for these children, then we can find ways to implement more empathy training in professional and caregivers who are in contact with these children. And once we test these levels and we find out the results, enhancing our levels of empathy can lead to decreased aggression in these children and also antisocial behaviors, which could greatly improve our society as a whole.